we use this vocabulary, Elizabeth and I, it's just the two of us still at Sonder. Look before you leap or leap before you look. And so I'm very much like a leap before you look guy. And she is much more than a look before she leaps. So it's like a really nice, healthy tension, which oddly is really great for starting something.
Akash, cheers.
Cheers. Thanks for having me.
Welcome to the podcast.
Thank you.
All right. So then you decided to leave and become a founder. It's clear that you like putting your hands in multiple things. You've talked about that. So I get the passion and I see the entrepreneurial energy there. But how did you decide that it was the right time?
Yeah. So I think one of the biggest reflections of my time at Medallion, so I'll say positives and negatives. Positives, really, like there was no better place to learn how to leverage AI than to be in an operationally intensive tech-enabled services business and be responsible for a lot of that rip and replace automation work. Like that was I feel like it's given me such a head start.
Your learning pace is probably infinitely higher.
Yes. And I was like watching a lot of these companies over, very closely. And so I got a chance to see I come at it from a much more informed perspective. When I think about voice AI now for my own company from like when I skinned my knees over there at Medallion. So that was amazing. I think it also formed a lot of my perspectives around what was challenging about the rip and replace AI versus AI native. I'm obviously learning AI native for the first time as a founder, but I had so many moments during my time at Medallion where I was like, damn, this would be so much easier if I wasn't ripping out a piece of software and replacing it with a different piece of software that's also leveraging AI and then to build a surface area for escape valve. And there was just a lot of stuff like that where I was like, this would be so much easier to do from the beginning versus from scratch. So that was great. And then third, I think I got a lot of experience as a professional manager. Not that I wasn't a manager at Ribbon, but it's just different when you're managing a team of PMs and I own the strategy at the end of the day, but I have to draw the right, kind of create the right sandbox for every person to kind of go solve problems in a way that gave them enough structure, but also enough little niche to go do whatever they wanted, try and solve the problem. So I think that was very fun as well. I think I sharpened a lot of my product management leadership skills. Those are the positives. The challenges, and really why I left, I had mentioned a desire to try out the scaling phase of a company. I think I very quickly became a professional manager, and I don't even want to say in some cases a product leader, more a professional manager. I think when you're in a 400-person org, it's very layered. And so I was a director of product, reporting to a VP of product. And so a lot of the job, which probably harkens back to I think that probably resonates for you from time at Amazon places, it's about influence.
Yeah.
It's about driving alignment. It's about
managing up and managing.
Yeah, exactly. And I think there's parts of it that I found fun and meaningful, but I think going back to too many hands, hands in too many cookie jars. I like the moving fast. I like flat orders. I think that a lot of that kind of got exhausting. I felt like I was spending more time getting decisions approved than actually executing on those decisions. And so I just felt this desire to short circuit some of that time to execution. That's really kind of the thesis behind why. And then I think there was also this deep-seated fear that I was falling behind in terms of my skills.
Your builder energy, probably.
Yeah. I mean, I don't know if you feel this way. We've been force-fed best practices on how to do all sorts of stuff, product management, other writing, anything. All of that has changed. And I don't think we've landed on what best practices are now for this new world we're heading into. And so, especially somebody who's no longer in IC, no longer in the weeds, you asked about using AI. I think my grasp were using AI a ton for their day-to-day work. I was not, because I was writing strategy memos and giving them advice, right? So I think there's just this fear of I need to start getting my hands dirty again. Because I think I'm I could easily turn myself into a dinosaur 5 years from now.
Right.
So those are kind of the two things. Ironically enough, my thought process was I'm going to go for a VP of product role at a C or Series A startup. So I wasn't actually thinking about that. My thought process was if I'm
let's go earlier.
Yeah, let's go earlier, but let's be the very, very top and be on the executive team, which I had not done before. And so the thought process was I'm a fine sim product strategy. And that short circuits, I can still kind of keep climbing the the ladder, And like most of these companies I was talking to, even though I would have been a VP of product, I would have probably been, if not the first product hire, I was going to come in and manage the first product hire.
1, 2,
Yeah.
maybe 3.
It's a lot of hands-on, which I wasn't necessarily sure if I wanted to do hands-on long term, but I definitely want to do hands-on for a year or two to kind of get my hands into like the worlds that we're
Back in,
Yeah. So that was the thesis. What I very much realized is it is a lot of work to be like one of the first employees at a startup. I knew that going in. In the other experiences I had, which were earlier career, it was the risk reward was justifiable by virtue of how fast I learned. I think one of the reasons I always push people, you can get into a startup around great people you can learn from. You might learn some bad habits, which we can chat about in terms of PM. I think that also sometimes leads to a lot of bad PM habits, but you learn a lot faster. So there was a reason to put up with it. I think earlier career, I think as you get older, more experienced, I think one of the reflections that I was going through the interviewing process for VP of product roles was, man, I'm only working as much as the founders with like way less upside. And it's like, I'm not getting this like learning experience that I want. Maybe the learning experience I would get is like get my hands dirty with AI, but I could do that as a staff PM somewhere. I don't need to be like a VP of product early stage. So I was kind of like I'm not sure what I want. And so I had this moment of clarity where like I had gone through the interview process with a couple companies. I had some offers that were basically like durable offers or like actual offers in hand. Medallion was trying to convince me to stay. And it's just been this like crazy, like I've been working, interviewing, I'm like wiped out because I'm doing like 2 things at once. And so I was like going to this weekend, I'm like, this weekend was sit down and just like pick one of these opportunities and run with it. And that weekend, I just like couldn't shake the fact that like, it's like, I'm not really excited about any of these. And I think part of it was those reflections I just shared. And then part of it was the thing that I had mentioned about the learning from Ribbon and about like the value of the product, the ROI. Is it attributable? I'm going to add another thing into the mix that we should talk about also is like defensibility from AI. That's another thing I was thinking a lot about when I was looking at some of these companies. I was like, none of these like feel like they have the right mix of these things. And ironically enough, like that weekend, I was like, it almost would be easier to start my own thing because it'll be just as much work, but I can like try to guarantee these like confluence of factors around like the right North Star and the value and the ROI and like making sure it's attributable and picking a market or a product area that is like going to be defensible against AI. Like I'm like well equipped to go find a place. And maybe if I find another startup that already exists that's further along, I like the people, maybe I can join as like a lead stage co-founder or the VP of product there. But it might almost be helpful for me to like assess different areas under these criteria and see where I land in terms of different opportunities. And I can still always go back to like joining a company that like is thinking about it the same way for an area I'm interested in. So that was kind of the thought that weekend.
What about the risk profile of
starting your own thing?
Yeah.
Yeah.
I mean, it's like, how did that factor play into that weekend's decision making?
Yeah. So for what it's worth, like that weekend, it was more just like that the seed was planted. I was kind of like, oh, this could be like, like this would almost be easier. I wasn't even necessarily thinking about I have to start something, but I was like, what if I went and just looked at the whole healthcare universe? So I'm saying healthcare and did this exercise and found areas that I think met those criteria. And then I can go see what startups are there or maybe start my own. So I think there's,
okay.
So that's kind of how I was thinking about it. And this is where like, I strongly believe in like universal alignment and fate. That same weekend, I mentioned this Venture for America program I did. I have a friend, Elizabeth, who was in my same cohort. So we know each other for 10 years. I recruited her to Ribbon to be our first enterprise sales hire. She's kind of like a big whale hunter, like prolific healthcare enterprise seller. She's the one who figured out from a strategic selling standpoint how to move up market to sell the payers and health systems. By the time she left Ribbon, she stayed longer. She stayed almost to that acquisition. She was leading all the sales and working with them. I went to her husband's birthday party and I hadn't seen her in a couple months. Me and her had been very much responsible for Ribbon's initial strategy and moving up market. It was kind of this very much like 0 to 1 inside of a startup that was scaling. And so we always joked about starting something together. I just happened to be just telling her all of this, like not even about starting a company. I was just like, man, look, interviewing all these places and I'm excited. And I was like talking about some of these ideas. Like I was like, it'd be cool to like, go like look at specific problem spaces that are interesting. Um, and we, like I said, had always talked about starting something. And it was like one of the first times where I think the first time ever where we both, she was like, actually, I think now is the time if we want to do it. We both had a couple drinks, so I was like, let's talk about this sober. And we met for coffee, hungover, literally the next morning at like 8:30 in the morning on a Sunday. Talked about it. And we're like, okay, still interested in doing this. What does it actually look like to get something off the ground? I'll talk a little bit about that in a second, but that's kind of the arc. It wasn't this like well thought out move. Candidly, it kind of just like happened. But I think to me, it almost was like a sign that it was meant to happen because of like the way it just kind of like the stars aligned.
Yeah.
But that's kind of the journey, I guess, into like how we kind of stumbled into it. Is the way I would describe it.
I think the key factor there was the bias for action, following up the next day.
Yeah.
Because, like there are plenty of friends that talk about starting companies and going camping, have a great conversation at a party, and then like, okay, we'll talk in a couple of weeks. But you literally talked like probably 12 hours later.
And that's also the moment where I knew like she was like, because you're a couple of drinks, like, oh yeah, of course. Like, she also was like, no, like,
right.
Yeah, 8:30 tomorrow morning, like, let's get coffee, right? We talked about it.
That's key. I think just like keeping that momentum going, you never know what can come out, right? There doesn't need to be this like, we need to sit down for a whole day and dedicate a day to brainstorm just how to start a company.
It's, I think a lot about, we use this vocabulary, Elizabeth and I, it's just the two of us still at Sonder. Look before you leap or leap before you look.
Mm-hmm.
And so I'm very much like a leap before you look guy. Like I woke up one morning and I'm like, I'm going to go travel for 6 months. Like that's kind of how my brain works. And she is much more than a look before she leaps. And so like that month after that initial coffee, we really dug into like, what does it look like to start something together? Mm-hmm. Like, are we on the same page on what type of business do you want to build? And I mean that more so like venture scale outcome, small business. Like we like really talked through like, we like forget the idea. We didn't even talk about the idea the first month. The first month was just de-risking, starting something together.
Yeah, and driving alignment on what you think.
But I'll be the first to tell you, I was ready to get started like day 2. Yeah. I like really appreciate the tension there of like she needed that time to de-risk doing this. But I think actually it was very helpful for me because once again, I'm a leap before you look guy. So I wouldn't have thought through any of the details. And there was a lot of things we figured out about the two of us, even though we had worked together before, about what it looked like, blind spots, those sorts of things. We did reference calls on each other, even though we like worked together for 3 years.
That's funny.
Yeah. To really make sure we knew what we were getting into from a both professional, personal standpoint, and that we knew we wanted to do it with each other. And then I obviously was pushing her a little bit to move faster, which I think like you can always get this like never ending analysis paralysis. So it's like a really nice, healthy tension, which oddly is really great for starting something.
Yeah, totally.
For us, it was helpful because like month 1 was just de-risking each other. And then we started talking about like going and looking at specific problem spaces.
And this was while you were still at Medallion?
I had put in my notice at Medallion 2 weeks before this had all happened. I was far enough along with the BP of it.
I see. So
I was kind of like, I know I'm going to leave. Yeah. She was still at her job for what it's worth. And so like she had to leave. But yeah, so all this happened very fast. But to your point, the bias to action of like, even just agreeing to get coffee the next morning at 8:30, like started the clock. And then for me, I was already ready to go. And I think for her, it was like, no, let's like actually spend some time because there's one thing I can share and I've learned is like the founder relationship matters more than anything else. Like the co-founder relationship, I think in the early days of the company being successful. And when you talk to investors, the founder breakup rate is like at an all-time high. Mm-hmm. And like they actually view it as like the riskiest part of like investing in a company is like the most likely reason the company fails in the first year is that the co-founders break up. And so I think I'm really glad now looking back with hindsight that we took our time with a lot of these things, even though we knew each other for 10 years and worked together for 3 years to like de-risk a lot of that. And I also candidly just don't know how people start stuff with like random people they meet, like they'll find a co-founder out there.
Why do you think the co-founder breakup rate is so high? Has it increased?
Yeah, I mean, they say it's increased.
Huh.
So I mean, I like 6 months into this. I don't know for sure, but I think here's my two.
Well, you got to make it 6 more months.
Yeah, exactly.
Since the outbreak up.
I think there's 2 things that I think could be considered on. One, a lot of times people start companies with friends, but not former coworkers, so you don't know how each other work. And so I think that's like you just like might have some like tension, and then you don't have like necessarily the time or the vocabulary to like do conflict management well.
Yeah.
Like I think one of the things I like look at now with Elizabeth and I is like we fought before in a context that when we were going 0 to 1 at Ribbon. And so like we already have a framework in place for how to like have like a thoughtful conversation. And I think there's at least a couple times a week where there's like a strong disagreement on approach with something, right? And the trust there to do that.
Yeah.
In a way that like you're not like taking it personally. So I think that's one.
How to manage disagreement.
Yeah. The second, which I think doesn't get talked about enough, and I've met founders or like now engineering candidates that were not. I met people that have started stuff, and this is the reason why they're like co-founder relationship broke. Is like you're not aligned on what type of company you're building.
In what way? Like what? How do you
Like,
define the type of company?
Yeah, like some of it could be as simple as just like I don't like this problem space. Like my background before, like when I first started, I was like genomics. Like Elizabeth and I were joking about like problem spaces. She's like, I definitely don't want to do genomics there, right? Like some of it's just like you don't know which direction you end up in. I think some of it's like company outcome. Like we spend a lot of time talking about like how much you care about like building a $1 billion business. For me, the answer is not that much. And for her, it was also not that much. But it's like one of us wants to build like, a $5 billion like transformational generational company, and that's the only thing that means we've been successful.
Yeah.
Like if we accidentally stumble into that, we're still shooting for that. Obviously, we have investors, but like that's not like for me. Solving the problem was more interesting, and I was obsessed with, and I wanted to actually solve it. I think she brought a very similar mindset. So I think those sorts of things can often cause a lot of friction because there's so many people influencing you to go in so many different directions. If you two are not on the same page about like what you're trying to do, I think that can cause like that's like a foundational misalignment. Not like we're misaligned on this person you might want to hire and you like them, I don't like that. This is like foundational to everything the company is, and so I think those are the 2 big reasons.
Okay,
that I can believe at least from like 6 months.
I think that makes sense. I think there's a lot of founder dating that happens, and being in New York, I think we see it probably more than elsewhere. But there are a lot of people that are frustrated with their jobs and want to start something, and they don't have the network, to your point, of people that they can confidently go and start something with. And then you end up finding someone that you met at a networking event, and you have a couple copies and suddenly you start a company. And who knows what happens after?
Yeah, I mean, there's been wild success stories that come out best friends afterwards. Like, I'm not saying that, but I just think like when you're put in a position to do stuff like this in that short of a time frame, like you kind of are rolling the dice. I think so much of like starting a company is like that initial momentum, but there is a benefit to like, and we'll get into this a little bit in terms of product and like what I've learned and like how I've taken what I've done into this experience is like, there's not a single thing I've done in the last 10 years that hasn't in some ways been helpful in founding something. And so there's probably like a point where like maybe you've been not a founder for too long and it's hard. Like I think I don't know what that like inflection point is, but I think like as 2 people in their early 30s starting a company, in some ways I feel like it's almost been easier. Like you end up built a network.
Yeah.
You're just older and you're like a little bit more
experience matters.
Yeah. Yeah. Like the highs you don't get too high, the lows you don't get too low. You've just done a lot of stuff, you manage a lot of things. Like I think like all of that kind of like for us, it felt like a shortcut to maybe comparing us to like a 22-year-old trying to get the company off the ground right after college. So I'm kind of glad I waited, but I obviously have friends that like didn't wait, and I think they're both the valid paths, but there's just a lot more you have to like just power through in that.
So what is the problem that you're solving?
Yes.
And maybe tie that into the product market fit path that you're.
Why don't I explain how we landed on the idea? Because I think it will explain kind of the thinking behind this idea. Is interesting. So Elizabeth and I get aligned. We say we're going to do this. okay, like what's the business plan? No name, no idea. Like we got to go find something.
Mm-hmm.
The only thing compelling about this business at this point is like two very experienced healthcare operators starting a startup.
Yeah.
Investors are already kind of like, oh, that's cool. But like, we have nothing in terms of what we're going to show. So this is where the product management stuff to me was so helpful. And I hope Elizabeth would agree as well, because it became kind of like a market sizing and kind of opportunity sizing exercise. And then root it a little bit in terms of like where we are in terms of like technology and like execution. So like the way that we thought about it was, let's just pick problems. And when I say problems, I don't really mean like specific problems. I mean like really like the most broad strokes version of like a problem. Like an example of one that we started with, which is actually how we accidentally landed in Sonder, was I read an article in the New York Times that rural hospitals are closing because they're becoming financially insolvent. Like that is not a problem you like that's not a investor pitch or like a company. But I was just like, oh, that's interesting. And so we would pick problem spaces like that, and then we go deep on them for 2 days, do a bunch of research, and then we come back together, and then we either like say yay or nay. If we say nay, kill it off. If we say yay, then we go one level deeper, and we kept doing this for like about 2 months.
Did you do that linearly, or did you kind of have like a hot list of 3 to...
So we started with like come with 3 to 5, pitch them to each other, kind of pick which ones to go deep on. And then we kept like, and then you kind of like stumble into other problems as you go, or you're like starting to talk with some investors or some other friends that are founders, like what other spaces, like people always do like the requests for startups, like, like YC does that every year. A lot of investors do that where they're like, here's problem spaces we think are interesting and the opportunities. So we looked at a lot of those too.
Mm-hmm.
But I think the important thing is just like the rigor behind like, okay, we started this like broad idea of like, how do we save rural hospitals? I'll just use that as an example because that is actually how we backed into Sonder. Why are rural hospitals failing? Okay, like they don't have enough patient throughput. The reimbursement rates are getting worse for Medicare and Medicaid. And then you then add in the big beautiful bill, which is going to add a lot of Medicaid cuts, which is fully under.
Yeah.
And so we were like, okay, what does the hospital care about? They care about being profitable. And we're not going to like wild profit. We're seeing like 1% profit is like 50%.
That's huge.
Right?
Yep.
These are often like -5, -10. So like what are things that are happening in the hospital that we can do to help improve their profit margin? And we're specifically looking at rural hospitals. We were not looking at all hospitals. And so as part of that process, we like mapped out from the moment a patient enters the door in the emergency room to admitted to the hospital, a patient, what are all the things that are happening?
Mm-hmm.
And so we mapped all that out and saw how like different steps in the process tied to like operate, like where's their high operational spend, but probably an opportunity to like do something interesting with technology or services. That exercise was originally how we landed on the problem we were talking about. But I think it's very important to call out what we realized along the way is that rural hospitals were so screwed that a single startup was not really going to be able to move the needle for them. We need like government intervention, which is like partly happening now, but partly not. And they don't have the money to pay for a product. We did some like light work, and I'll talk about kind of like user research in a second, because as we get closer to like a tighter problem space. But as part of that exercise, we landed on this discharge problem, this idea that like a patient who has been admitted to the hospital spends days in a bed getting treated. And then when it comes time for them to leave, they start planning for the patient's discharge. And what often happens is that process is really complicated. And even though the patient's like medically ready to go, they might end up spending a couple extra days in the hospital because of all the operational work that's required to get them out of the bed. And we were like, as we were digging into like the rural hospital operations, what we found was that actually had some of the largest impact on the operating margins of the hospital. It was like one of the ones which had like most outsized like negative impact.
Meaning like where the hospital is located?
No, like not like, sorry, the delay in discharging a patient,
I see,
was one of the biggest things that drove them into the red. And once again, we're only looking at rural hospitals. But then we started talking like, we're just like, this is interesting. We start pulling the thread.
Mm-hmm.
So now this is where we start just having tons of interviews, talking to the end user, which means case managers, discharge coordinators that do this work. We start talking to chief medical officers, chief financial officers, and just deeply understand the problem. And what we really quickly realized is a problem all hospitals have.
How did you manage to get these people on the phone to talk to you?
Yeah, honestly, this is where the network really helped.
I see.
Yeah, like Elizabeth's network, my network, 10 years in the industry, like I could call in a favor and someone's like, this person's not. And yeah, we're on a call with my buddy who's like chief medical officer. But
what's your pitch? Like, is your pitch that we are building something, or is your pitch that you are just wanting to learn?
No, wanting to learn. And I think that's important because I think people were willing to take a call. I think so many people along the way have helped us, but I think on the virtue of like, we're just looking for help. We're looking for insights. We're trying to understand the space better. And so a lot of people were able to make intros for us, friends. We've tapped our own network. And so we just, I mean, once again, it's just user research.
Yeah.
And not even user research. I would like to say validating the problem.
Yeah.
And so what we learned was this isn't like this discharge delay problem affects every hospital in the country. Most chief medical officers, chief strategy officers would call it one of their top 2 or 3 problems. Great. That's something. We've like validated a market pain point. There's a whole other aspect of this, which I think is really important. It ties back to product and a lot of the things we've talked about, which is, okay, if it's a top 2 or 3 problem, that's great because, you know, in healthcare, everything's a problem. So if it's not a top 2 or 3 problem and it's a problem that's not solving, then people won't for it.
Right.
So that's great. And then we also did a little bit of like, stick with me a little bit, like chief medical officer. If I told you I could reduce length of stay by half a day, would you pay money for a solution? So we started to get at least some like light assessment of like willingness to pay.
Yeah.
They were like, yes, absolutely. I don't know how you're going to do it. This is really my problem. We've been doing it for 30 years. We can't.
Right.
It moves on. It's like, yeah. So that was helpful. And then like, I think the other thing is like through these interviews, we started to get to a tight, we talk about a smallest atomic unit, right? Because being important for startups earlier, like we got into, okay, what are the patients that this happens to most often? And that's when we stumbled on, there are patients that are going to not go home, but they're going to go to another facility. That's not a hospital, but still going to treat them inpatient, which is like a skilled nursing home, long-term care, hospice, physical rehab. And those are the patients that often get stuck for 2 to 5 extra days after the medical clear. And so we were like, that's the patient population we want to focus on.
And that skews older, right?
Skews older. And as we looked at the problem and we talked to some of these folks that do this work, they were like, oh, it's because we spend so much time building these prior authorizations packets that we send to the insurance companies. We spend a bunch of time building these referral packets we send to the facilities to get a yay or nay on the patient. We just saw this like operational work. And I was like, okay, this is a software solvable problem. This isn't like some perverse healthcare incentive where it's like, I can't change the laws in like the state or at the federal level to actually make this better. And so we were also like, I was doing some like light assessment on just like, are these solvable problems? Like, you know, if the solution to the problem is raise money and then there'll be a lobbyist, like that's not actually the thing we want to do.
Yeah.
So that was important as well. But then we started applying a lot of those elements that we talked about as being important throughout my job searches and my career, right? Like, what is the North Star? Okay, we want to reduce unexpected, like excess length of stay in the hospital. Great. That's something we can measure, right? Like if we say for a given patient, for this given cohort of patients, the length of stay before they worked at Sonder was X, we can measure what that would be after working with us. So that's attributable and measurable. Okay, what's the value? Every day, length of stay, they actually lose money. And so we've actually figured out, like we built a really crude financial model where it's kind of a 2-pronged thing where the first is, it's like a restaurant. You know, you want to turn your tables over. If you've got a patient in a bed, you want to replace it with a patient that needs care. And you can generate revenue on the patient. And then most importantly, like with that is hospitals are also kind of having their own like bed availability problem. And so it's like, they need to get patients on beds.
It's a shortage, right?
Yeah, exactly. And so there's kind of this like, I call it the restaurant model of just turning tables, turning beds over that they care about. And then the other thing that's important, it's very critical to the patient population we serve. The way Medicare and Medicaid work, when you get admitted to the hospital, there's something called a DRG code that tells the Center for Medicare and Medicaid Services what your clinical event is. So an example, heart attack. And what they do is they look at how long and the complication, how complex the care is for a given DRG and come up with a benchmark for how much they reimburse for that event. And so you don't get paid by services rendered. You get paid by like, for all heart attacks in the state of Maine, we pay $10,000.
Okay.
And this is really important because imagine you did everything, the patient's stable and ready to go home, but they stay in a bed for extra 3 days. They're not getting paid more money for the 3 extra days they spent in the bed. They're still getting paid on $10,000, but a hospital bed is very expensive to service. So they're still spending a couple $1,000s a day. And so now you can start to see this really interesting problem where the access length of day translates to like pure loss.
Loss, just pure. Yeah.
Yeah. And so we now have like a way to take this like length of stay and translate it to dollars.
Yeah.
And if we can translate it to dollars, then we can translate it to operating margin.
Right.
And so now we have this really beautiful through line to attributable, measurable impact and value. And then for me, what gets me excited as a product person, when we have a PM in the seat, is I can literally go like, I don't care what you prioritize as long as it reduces length of stay, right? Like there's a single North Star that is measurable, that is a game changer for a business, because whether you're in marketing, an engineer, you're a PM, if you can orient your team to a single North Star, I think that's when magic happens. And so that gets me really excited about like building against this problem as well. And then the last thing I'll mention, which I think is really important because we were talking about AI earlier, is defensibility from AI and commoditization. One of the things I'm most nervous about with healthcare is people are building stuff that a larger entity that has distribution, like an electronic health record system, will build a competitive, shittier product in and give it away for free.
And bundle it, low ball.
Exactly. And so there's a question of what is a problem space and a potential solution that is defensible against AI. And so what we thought about a lot when we were selecting what to go after was, is somebody going to build a competitive product in an EHR and give it away for free? And I can talk a little bit about what our product is and how it works in a second, just to drive the point home. But we wanted to pick something where I'm not necessarily, for what we're doing, worried about a competitive AI product that's given away for free, or like this like race to the bottom that AI startups are doing right now, where it's like you are just eliminating one task that happens often. The one that we always use in healthcare is prior authorization, which is when you ask the insurance for permission before, if certain things you'd ask for permission before you could get the care, because the insurance company has to like give you the thumbs up that they'll reimburse the care for the patient. So there's like a dime a dozen startups that are doing this, but it's like this like race to the bottom where it's like everyone's just trying to do it cheaper and charge less, and eventually you get to something that's a commodity. It's not.
How does that contradict with the perfection that you mentioned earlier that practices, patients, payers? Because if these bigger companies are inevitably going to build shittier products and cheaper prices, what matters most then?
So this is kind of one of the most challenging things. And I don't have an answer to your question. I'm maybe just going to like flip it on its head. And I actually would love your thoughts here. Is like, we've talked about this, right? Like the best products don't win in healthcare.
Yeah.
It's all about distribution. And so the really twisted sick game that often happens in hospitals, at least where we sell, like, is the CIO, the end of the conversation is like, if there's a competitive Epic module to what you're doing, like you might just be already dead in the water. There has to be enough pain around the problem you're solving for somebody to like go to an external solution that's better. So the insight there is not that people buy the best product. It's the pain has to be so great that the existing shittier product that lives inside the distribution is not good enough that it's worth bringing something in outside the ecosystem. And so that's the other thing with like selecting a problem space to go after for the company is, when I talked about the first criteria, which is like it has to be a top 2 or 3 problem, that's kind of the through line to like the execution piece for us, is like, if it's a top 2 or 3 problem, we also have some defensibility there in terms of like people will be willing to look at outside solutions if they perform better. If it's a top 20 problem, why wouldn't you just use the thing that's 20 to 30% worse, but it's free? That lives inside the distribution stack and is easy to implement. And so there is like, I think kind of this like interesting game in healthcare where like, yeah, people do buy products that are better. They go out and buy a better product, but it has to be for a problem that's like painful enough to justify doing that. Because like for most things, they're just willing to like live inside the distribution, the software distribution that they already have. And so that was like a very, very critical part of our research, was like going back to the problem, not a problem, of picking something where we had leverage to actually force the hospital to engage outside of like a paradigm that they're very used to, which is just like wait for Epic to come out with a module for something.
Is part of that educating these customers on what the problem actually is? Or is it that most of them understand these problems
Yes.
and you just have to come in with a better solution?
You got to come in with a better solution. Or
Or do you have to amplify the problem? Like, do you have to amplify the pain that you mentioned earlier so that they understand that?
I think all of these are viable tactics, but I think the companies that succeed, it's like organic. Like when I say organic, I mean like the pain is so great that they're like already like, oh, the Epic. I'll use Cedar as an example, which is a real prominent health tech company here in New York. They do billing software for hospitals. Um, Epic has a billing module. Their like inflection point on like early traction is like this idea that like the pain is already so great with the Epic billing module that the people are already looking for alternatives. So like we can't use the Epic billing module; it's failing us too much. We'll do this. Like they didn't have to like, yeah, they like maybe not educate. They kind of like create the guardrails to have a conversation, but like that thought is already in someone's head.
Yeah.
I think if the thought is not in their head, it's really hard to create the momentum to close a deal as an early stage startup. I think there's a world where, let's say, Sonder's wildly successful, and I have like really nice case studies about how we saved X health system $20 million. Then the system that doesn't feel like this is a problem might suddenly line up because they're like, I don't want $20 million out in my bottom line.
Right.
But I think in the early days, you kind of need to find that like champion buyers that are like, I already hate what I already have. And for our case, what's really nice is this is a space Epic has traditionally, and Cerner as well, gone out of the way to say we do not play the out of system referral space. So the way that this solutions work is we're building a solution that helps the nurse practitioners, the discharge coordinators, case managers that do this discharge work, manage a lot of the operational work that's required to get these patients admitted in these step down facilities, and do that in a much shorter period of time so that the patient gets out the door faster and actually saves the hospital a bunch of money. Epic, Cerner, the big EHRs are very interested in routing patients within the system. So like if I'm leaving the hospital, I need to go to a cardiologist, but usually going to the Mount Sinai cardiologist, right? These facilities that we're talking about are almost never owned by the hospital.
Right.
So this is not a use case. And so our biggest competition, there's a legacy player in the space, but it's also a solution that sits outside the electronic health record system. So we already had that, like, in some ways, a positive from a competitive standpoint, like paradigm set that people would go for an outside solution, not to Epic. And so that was like a very important, also, like, I wouldn't say it was the reason we chose this space, but like it was certainly in the pros column was like, they have historically said that we're not going to touch the space. The legacy solutions in the space and lived outside the electronic health record system. They're obviously integrated; they have to be, but that was important because we're like, that makes it a lot easier. You're not going to like, I go back to Cedar. The early story of Cedar was like they got a lot of traction because people hated the Epic module, but then what Epic started doing to them once they saw this company start popping up, that is a whole other level of pain fighting this like behemoth monopoly that's trying to squish you the little bug.
Yeah.
You ideally don't want to have to be in this position of like competing with a homegrown HR module. And so those are kind of like maybe the genesis of like factors that were like, when we got these like check marks and these things, we're like, okay, this is interesting.
Okay.
Worth solving. Very long winded, but I think it kind of ties all these like learnings across the different chapters together around like de-risking a specific problem space and potential solution.
I think that's probably where a lot of your product experience comes down to help.
Oh, for sure. I think like, I don't even know that most startups that are not founded by product hires or like multi-time founders would like take the approach we took. Most folks just start with the first idea they had and just pivot. Whereas I was like, we have a limited number. I think maybe the last thing I'll say here is like, I would argue that you should always bias action. So my advice is maybe not to do what we did if you're going after a market where you're able to pivot a lot. The reason why we took this approach was, once again, we were lucky to have a network of people that could make introductions to people that, are the chief medical officer of a 40 hospital system.
Yeah.
But I have a limited number of hands I can play.
Right.
I can't go back to that same person with a wildly different idea 2 months from now. And so I think we've just put a lot more time into like making sure we were as close to like certain as we could be before we played those hands, because I think we only could, had limited number of times we could like do that. Whereas like if I change what I'm working on for an orthopedic clinic, I can just go to a different orthopedic clinic and talk to. It's a little bit harder with hospitals, because there's like a finite number. And so we took a little bit more structured approach, but I think it, like, for me, I feel like glad, because I don't think my confidence wavers as much in terms of the problem we're going after, that as much as like any other founders, because like we've spent the time valuing the solution we're going to take to produce like this egg could change 10 times over, but the problem space and reducing this number, I think like feels like extremely de-risked.
Okay. And so then it's just you two right now,
Yeah.
right? And you're in the process of building out the product. And so maybe talk through what that building process is like, and then maybe your take on when is the right time to bring in a PM.
Yeah. I'm laughing because I know you and I have talked about this before, because I think there's often a proclivity to bring folks in earlier than they should. But
Right.
so for us, I think a lot of times you build the product as you're selling,
Right.
which is what we're doing. We are learning every day and then bringing that into, like, I built like some combination of vibe coding, and then just like I'm technical enough to be dangerous. I'll get download the platform. We would probably build it with that problem. We will build like a much more enterprise ready version of the software as part of like a full hospital deployment. But that's, we're talking about hospital sales cycle very long. And we've got probably 9 months to a year, starting with like the clock starting probably January, February next year, to get something built, right? So the goal would be to have something live with a hospital partner using it, let's say fall of 2026. But we are kind of just like learn, iterate. There's kind of this like sell ahead motion that you kind of have to do. And for what it's worth, like, we're really honest with our hospital partners. We're like, we're looking for design partnerships. We're not looking for customers. The idea is that you're going to co-build this. You have to do that in healthcare. It's the only way you can get the rich signal you need to actually build workflows the correct way. And so they get really favorable pricing. And, the way I pitch it to them is like, you get an outsourced hyper elite dev shop to basically like solve it for your use case. And there's some really challenging and of one things that I know we're going to have to do with an undo as we go for like, full commercialization. But it's really just like as many conversations as you can have. And for us, the name of the game is like more referrals. It's like executives at the hospital.
Aside from the risk of the product basically not scaling, if you're co-building it just with a few customers, from like a business standpoint, are you locking in those customer contracts before you co-build with them?
Yeah. So
like, what happens if they decide down the line that they don't want to work with you?
Yeah. The best way to do this, I think, is you need to charge some amount of money upfront. I think this is really important for early stage building. One, it validates willingness to pay, which you need to show your investors to make more money, and also just generally be sure you're like, it's a nice problem, the problem, right? That the problem itself.
Yep.
Two, it creates some skin in the game. I've actually heard of situations where folks have given stuff away for free, and then the hospital or whatever entity they're working with is not incentivized to like support them in further build because they've, like, it's not. If you're saying like puts $100K up front hospital, right? Then it creates like, oh shit, like we need this to be successful too.
Right.
And so that I think is important.
Yep.
Then there's some amount of like, what does the actual contract look like when it converts? That can be much larger. Or you can tie it to the outcome. So for us, maybe it's $100K up front. I'm just throwing, these are not actually the real numbers, but I'm saying making numbers up. $100K up front. And then we get another couple $100K if we reduce length of stay by like a quarter of a day or half a day.
Yeah.
So you can start tying it to outcomes, which at least that makes it a little bit less risky. And maybe the last thing, which I feel strongly about, for these large enterprise buyers, you need to make it as less de-risk it as much as possible. I don't think it's crazy to be like, you can cancel it all the time.
Yeah.
You just need to get started and pray to God that you can keep those customers and not churn them. But I think if that is the means by which you can get them on board with the risk profile of what they're going to sign up for, because you're kind of looking for a health system executive who's super innovative and kind of crazy themselves to like take a bet like this, and you just got to make it look really favorable. And like de-risk, and like product de-risking is also like about implementation scope, not product scope. So let's start with one floor of one of your houses.
Yeah.
Let's not do all 40, right?
Yeah.
So like there's also a really nice way for you to grow the account over time. Also, if you are able to drive that value.
I think it all probably starts with what you said earlier around making sure the problem is really a clear problem.
Yeah.
Like you could keep changing that over the course of growing. And the fact that you've locked that in early probably helps with retention throughout the course of the co-building period, I imagine.
Yeah. Because I think like we're aligned on what we're trying to do, and if there's like tangential problems that are interesting, so we started that for us as we like are progressing through sales conversations. Like, who knows? Like we fast forward 2 years from now, you have to be back on, and like the business completely changes focus. But still, probably I think we'll be focused on length of stay.
Okay.
Yeah,
makes sense. And then, how do you think about PMs?
Yes, PMs. Okay, hot take is I don't think seed, Series A, I feel like all these terms mean nothing really, like they're arbitrary, but like I think you should hire a product manager when you cannot do the like maybe create operational work to unblock your engineering team to continue.
And who's you?
And the founder.
Okay. What if the founder's not a product person?
This is also a good question. So here's the thing. I think you have to be the product person as the founder in your early days. If you are not, I do not think you will be successful. There's so many great folks I've met that have no product background, no tech background at all,
right,
that have ended up becoming great founders. Maybe they all do it in their own different way.
Yeah.
But they are all able to like figure out what we need and then figure out how to get the engineers on board. But I think the critical thing here, and I think this matters a lot, and I'm thinking about this a lot when I think about hiring, because I'm talking to candidates about what they want, founding engineers, is you need to hire the right founding engineers that can manage that, right? Because I think like as a product person who is now a founder, I actually think the pool of engineers I can hire is larger than maybe somebody who doesn't have a product background, because
there's trust.
There's trust, but also like even if you're a founding engineer that can't handle the ambiguity, like you're like there's a scale of like how much ambiguity you can handle and how easily you can figure out what the actual product requirements are from like really vague statements about what you need.
Yeah.
I think like the more like non-technical or further from product that the founder is, the more like able to handle ambiguity in your engineering team. So where I've seen this work well for founders that are not product people or not technical, they've hired the right engineering counterparts that are able to manage like their like non-technical, not understanding how the software built, like they're able to take and translate that. But I think where it's gone poorly is like if you have that person and then you hire this like founding user that has maybe, less of that desire, like then it's harder. Like I totally see this with candidates. They're like, I want a technical or a product person to be one of the founders, because I think you guys can articulate much more clearly what you're trying to ask me to do.
Yeah.
And so I think like I still would push for you should wait as long as possible to hire your first product person. But I think if you're not a product person or not technical, you need to hire the type of engineers that can handle like your like I don't know. I'm trying to think of something that's like authorization and RBAC is like the perfect example. Like non-technical, non-product founder, like somebody who's like never built software before, is like probably not going to articulate like what we need to do for authing into the platform. But I feel like you need to get the right engineers and see that can like meet you not even halfway, like 70% of the way. And so that's how I think about it. But I'm kind of curious for your thoughts, because I know you've like chatted with a lot of startups here as well.
Yeah, I agree. I think the most important thing is to understand what type of PM you want.
Yeah.
And inevitably there are going to be more founders who are not product people, just because the barrier to starting a company is a little bit lower now than it ever has been. But ideally, I think it comes back to skill set. How can you complement? And you talked about it with the co-founder thing, right? A product person is essentially almost like a co-founder. Your first product person is essentially like a co-founder, just without the equity, obviously. But it's important for the founder to understand what they're not good at and be really, really vulnerable about that, so that the product person that comes in can have the runway to go and set that up. Because a lot of times, if you want to hire a product person to be your executor, because either you aren't comfortable in the weeds as a founder, or you just don't know how to go from what or why to how,
Yeah.
then that creates what we talked about earlier, where that first PM role sucks.
Yeah.
The PM is going to have to deal with all sorts of chaos and crap. Whereas ideally, you want a PM to partner with you on a strategy that you are very clear about as a founder, on a pretty good direction of how you think you can get there. And then it's a matter of how do we sequence this in the right way and how do we scale, rather than how do we just build the initial product.
I would argue that for that reason, what you said, which I deeply agree with, that like I almost always feel like the first product hire, regardless of, we can argue about when you should hire them, should be like a really strong like IC, not like a product leader, unless it's like, I don't know, some person who's like so much like social proof and there's like what they've done before, where like it helped the business to have them. And like I just think like the IC, but that is like senior enough that they're also like strategic.
Hungry, experienced IC.
Like 5 to 7 years at least, and like IC, but like really can be like, has like moved out of like just like 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 when you think about PM1, PM2, like like we're not just like they can do that in their sleep, but they're like able to kind of like I think about like get the game, like they can go back and forth with the founder,
right?
On like some of the like real kind of like translation of like the strategic imperatives that are like tied to some of these things. So when I think about even when which we're probably way far away from with that like higher, I'm like I kind of in my head I know it's like 5 to 7 years, strong's like senior IC type profile, strategic, bend, but then can also in their sleep get their hands dirty and do all the dirty work. And then what's great about that is like I've seen a lot of times with those folks grow into being the head of products at those same companies. So you don't necessarily need to hire someone above them. If you feel like you need to later, you have an option. But I think it's like one of the most dangerous things with hiring head ofs, and I'm feeling this right now, somebody hiring a head of engineering is like, it's risky. And it's a lot harder to get right. You don't know what you're getting. And there's like a whole other bunch of like soft skills stuff that you have to think about when you're hiring a head of product that you're supposedly going to keep for perpetuity versus like bringing a really strong IC in. You might even see them grow into that role over time.
Final reflection, looking back at your story over your entire career and what has gotten you to become now a founder, what do you hope people take away from that?
Bias to action is very important. At the same time, patience is really important. I think I meet a lot of folks, and I'll tie this back to product. Talking about product, really, the through line here is, I think a lot of people want to get into the product. I don't think a lot of people want to take the harder route, right? Like we didn't talk a ton about this in this conversation, but I'm sure we had other folks on where it's like, how do you end up in product?
Yeah.
I did not start in product. I feel like most people don't hire PMs out of school unless like you're in a rotation program in big tech. Like you gotta be willing to get your hands dirty and just be useful to even like someone identify that like you even maybe deserve the right to like, try to do it. And so I think, I think people should think on longer time frames and be more willing to do things that maybe feel like they don't directly move the needle on the longer term goal. Like when I think about my career and I think about starting something or even getting a product, like so many things were like at the time looked like not directly helping, but have been so helpful. And I'm kind of like glad that I've like been a little bit more, while still having bias to action to make those big decisions when they come up, like taking the time to have like built the network and the knowledge and like built this, scar tissue around a lot of different things that are maybe not even related to product that have been incredibly helpful to me when I like think about product management leadership, or even starting a company. So I think those are like the things that I think are most important. And I think that the third thing I'll say is take time to reflect between big chapters of your life. If that's like one thing that hopefully people took from the interviews, like we talked a lot about like what I learned from the end of each thing and how I applied it to the next thing. And ultimately those became the criteria by which we identified what the idea we went after was. And so I think that's really, really important. Like I think for the rest of my life, whether I'm starting companies or joining companies, like I'm planning on taking like we can argue how extended break is, but take a break between every chapter and take time to really think about like what I learned and how it informs what I do next. Because I think like that to me has felt like it's compounded over time in a
Amazing.
really powerful way. So
Awesome.
cool.
Akash,
Thank you so much for having me.
thanks for coming on.
Yeah.